Hello dear judges. My name is Ataiga Rajan Paramasivam from a School of Pharmaceutical Sciences, University Science Malaysia. The title of my innovation is Revolutionizing Biopharmaceutical Education through Peer Learning and Web-Based Innovation. Okay. Foremost, what is biopharmaceuticals? Biopharmaceuticals are medicines produced from living cells or biological sources rather than through conventional chemical synthesis. For instance, monoclonal antibodies, vaccines, insulin, growth hormones, and gene or cell therapies. And for pharmacy students, understanding biopharmaceuticals is no longer an option, it is an essential knowledge, which is also emphasized by the Malaysian Pharmacy Board. Therefore, equipping pharmacy students with strong knowledge in biopharmaceuticals is crucial to preparing them for the future healthcare. It is undeniable that teaching biopharmaceutical drugs has its own struggles. Biopharmaceuticals are a relatively new and rapidly growing field. Perhaps it is due to the COVID-19 pandemic because most of the COVID-19 treatments are based on biopharmaceutical drugs. Hence, one of the challenges of teaching biopharmaceutical is that the information about these drugs is widespread. And more and new informations are being discovered almost every day. And literally no textbooks to cater these biopharmaceutical drugs are available in the market. Okay, that brings us to our intervention based on peer and a web-based learning. Hence, my innovation is a website consisting of drug guidance for the top 50 selling biopharmaceutical drugs. This approach does not involve any hard copies, which makes it lower cost and can provide up-to-date information to students, lecturers, healthcare providers, as well as public. Okay, there are three objectives for my study. So the first objective is to develop a website consisting of a drug information of the 50 biopharmaceutical drugs. The second objective is to utilize the IoT for easing the learning of biopharmaceutical drugs. The third and the last objective is to estimate the student's preference on the knowledge delivery using a web-based approach and peer learning. Okay, approach. So students from three different batches of the Bachelor of Pharmacy, University Science Malaysia participated in this study. Okay, which is this one. The students were divided into 50 groups and assigned to a biopharmaceutical product. The group gathered information on the drugs, which is including generic name, dose, route of administration, side effects, and precautions from various sources in the form of a drug material sheets in English and as well as in Bahasa Malaysia. The findings were also designed as an infographic for ease understanding and quick reference. These materials were then shared in the Padlet to validate the content by the other group members. And upon content validation, these materials were presented in a Google site in the form of a website, and the link was shared among the other students for their feedback. And one thing I would like to highlight here is that the entire work was undertaken online and no hard copy materials were involved. So this is the website, and to the best of my knowledge, this website could be one of the pioneers which will serve as a one-stop service provider with comprehensive and updated information on biopharmaceutical drugs. The website is vibrant and definitely is user-friendly, and I believe it will be an ideal tool for students, healthcare professionals and public because the infographic also translated into Malay to cater for the public. So the feedback from the students on the learning activity showed that most of the students, which is about 86%, preferred the design and knowledge delivery through the web-based learning. In addition, many of them gave their thumbs up to the approach, stating that this approach effectively aided them with relevant information on biopharmaceutical drugs. And we have also received a positive written feedback from the students. Okay, in regards to recognition and commercial potential, so the website has been shared with students and staff from the School of Pharmaceutical Sciences, University Science Malaysia, as well as the staff at Hospital Pulau Pinang. Several of the infographic has been copyrighted to protect the intellectual property, and moving forward, the website has strong potential to be further developed into a data analytics prototype with enhanced functionality and wider application in future.